In this question, a 59-year-old man comes to the clinic because of progressive fatigue and reduced exercise tolerance over the past 4 months. He says that he becomes short of breath after climbing one flight of stairs and has had 2 near syncopal episodes when standing quickly. His medical history includes hypertension and hyperlipidemia, treated with lisinopril and atorvastatin. He drinks alcohol socially and does not smoke. On examination, his blood pressure is 110/70 while supine and 92/62 while standing. His pulse is 74 and regular. Jugular venous pressure is mildly elevated. Cardiac auscultation reveals a low-pitched mid-systolic murmur at the apex, best heard when the patient is lying in the left lateral decubitus position. An echocardiogram shows normal left ventricular systolic function and left atrial enlargement. Which of the following hemodynamic changes is most likely present in this patient? Right, so there's a lot of stuff written on here. All right, so one thing that I would always go with first is perhaps trying to look at the murmur, what kind of murmur it is, all right, and where is the location of the murmur. So if it's at the apex, right, that will tell you that it's probably going to be a mitral valve issue, right? Now, mid-diastolic, so it's when it's filling, right? So fluid is going to cross the valve from the left atrium into the left ventricle. So what's going to happen that will cause a murmur at that point, right? It's most likely going to be a mitral stenosis. And there's probably the murmur that's called, like it's described as an opening snap. So that's like the buzzword for it. So opening snap. That just means that the murmur or the valve is so stiff, right, that it takes a while for the pressure of the blood to push through, and then you're going to have a snap. So from the atrium to the ventricle. Now, this should not be confused with the mid-systolic click. That's the one that is from mitral valve prolapse. All right. So now that you have that, so what are you going to have if you look at the options, right? So decrease atrial pressure. Now, if there is a hindrance in fluid going from the left atrium to the ventricle, there's probably going to be an increased atrial pressure. So that option is out. Right? Increased pulmonary capillary wedge pressure. Now, the pulmonary capillary wedge pressure indirectly measures the pressure of the left atrium. So that is going to be your answer. So if pressure is increasing in the left atrium, then you're going to have an increased pulmonary capillary wedge pressure. All right. So we'll see you in the next one.